Namaste everyone and good evenings. And thank you for the scientific committee, NRA and ANSVIR. Today I'm going to present one of my articles about the outcome of the trans-jugular intrahepatic Porto-systemic shunts and gastric coronary vein embolizations for esophageal and gastric variceal bleeding patients with cirrhotic portal hypertensions. So especially you are indicating the tips with the gastric coronary vein embolizations, and also the one of the key is the especially for cirrhotic patients portal hypertensions and non-cirrhotic non-cirrhotic portal hypertensions. So my this article objective is the study was evaluated the efficacy and safety of the tips with gastrocoronary vein embolizations in cirrhotic portal hypertensive variceal bleeding. Additionally, we compare the outcome of the first line and second line treatments and a spring coil with the glue embolized of gastric coronary vein and between the single covered stent and double cover stent respectively. So introductions, trans-jugular intrahepatic Porto-systemic shunt is and the established and the minimally invasive procedures for treatments of complications of cirrhotic portal hypertension such as the esophageal and gastric variceal bleeding and the refractory ascites. So TIP is significantly reduce the portal venous pressures through the placement of an artificial stent from the portal vein to the hepatic veins. And gastric coronary vein embolizations has been the approved as an effective and supporting method for control of the esophageal and gastric variceal bleeding, and most of the studies focused on the use of the tips as a treatment for recurrent variceal bleeding when the pharmacological and endoscopic treatments failed to prevent the recurrent variceal bleeding. However, in this study, the 15 cases were treated with the tips and gastrocoronary vein embolizations as the first line treatment for variceal bleeding, and 45 cases were treated with the tips and gastrocoronary vein as a secondary prophylaxis for recurrent bleeding after the primary treatments. So this is one portal vein system. So the material and methods we conducted, the retrospective study was based on the patients with cirrhotic portal hypertension accompanied with the esophageal and gastric variceal bleeding who underwent the tips and gastrocoronary vein embolization treatment from January 2015 to August 2018 at the first affiliated hospitals of Chengchi University in China. So inclusion criteria were the chief complaints of the esophageal and gastric variceal bleeding caused by the cirrhotic portal hypertension based on the clinical and radiological or endoscopic LFT and the radiological finding. No contraindications for the tips and gastrocoronary coronary vein embolization treatments and variceal bleeding treated with the embolic agents during the tips procedures in our departments. The inclusion criteria were patients without the variceal bleeding and portal veins thrombosis, Burch-Cherry syndromes, and chronic liver disease, coagulations disorders, and variceal bleeding treated with the embolic agents before, for, and after tips procedures in our department or other departments. So 60 patients were assigned to the two groups. One group, the patients were treated with the tips as the first line treatments, who is admitted in our departments after the first episode of the variceal bleeding with more than 25 mmHg, PS, or active bleeding, variceal bleeding with childpox B and C, and high risk chance to treatment failure with the pharmacological or endoscopic therapy. So other group is 45 patients who are treated with the tips as a second line treatment after failure the pharmacological and endoscopic therapy, or both to control the variceal rebleeding. So this is tips procedures is a technique. I think this is a little big, so I want to skip this ones because of short of time. And this in this table is like I have taken the comparisons of the hematology and biochemicals and portal vein pressures. So in this statistical analysis, we can found the like portal venous pressures is significantly, and child poke is also have significant, and one is also the like hemoglobin and the like platelets. So statistical analysis measuring the data where they expressed as a mean standard deviations, and preoperative and the postoperative quantitative variable where the compared using the parity test, and the incidence of the survival rate, rebleeding, hepatic encephalopathy, and the Shunt dysfunctions were analyzed using the Kaplan methods. The results: a total of 16 patients diagnosis with the cirrhotic portal hypertensive variceal bleeding and treated with the tips combining with the gastrocoronary vein embolizations under the local anesthesia. There were the 14 males and 19 females. So most of the common etiology of the liver cirrhosis was hepatitis B virus. And pre-operative child poke score was the B class, and post-operative child poke score was the more is A class. And after the tips and gastrocoronary vein embolizations treatment, rebleeding occurring in 15%, Shunt dysfunctions in 20 cases, and the hepatic encephalopathy in 9 cases, and survival rate at the 1 and the 2 years were 96.6% and 89.7% respectively. The left portal vein was puncturing the 90%, and then right portal vein puncturing the 10%, and stent was placed between the right hepatic vein and the left portal veins around the 48%. Middle hepatic veins and the left portal vein is 36.6%. Right hepatic vein to right portal vein 10%, inferior vena cava and the left portal vein 3.3%, and left hepatic vein to left portal veins 1.6%. So single covered stents used like 45%, and double stents 51.1%, and barrier were using the 3.3%. So patients were embolized with the aspirin coil of different size 65%, and glue is using the 35%. So this is the result. The rebleeding after the 1, 3, and 6, and 12, and 18, and 14 months is rebleeding rate is were high around like 38 months. 1 year is high. And Shunt dysfunctions rate is more is high in the also the around the 1 years. And hepatic encephalopathy is also high 1 years. And survival rate is where the like low like after 5 years, and 1 month is 100%, and also 3 and 6 is 100%, and 1 is 96.6%. So rebleeding between the first line treatment and second line treatment is treatment groups is Kaplan-Meier syndrome showing the significance 0.012 p-value, and survival rate between the single covered and stents group and the double covered stents is also have a significant So discussion the tips for the control and prevention of the variceal bleeding due to the cirrhotic portal hypertensions and variceal vein embolize has been approved as the effective and supportive method to control the variceal bleeding, and previous study have reported that the tips combining with the variceal vein embolizations are the more effective for rebleeding and improvement in the liver functions. So treatment, the tips treatments can significantly reduce the portal venous pressures, and it is a more effective treatment method for the esophageal and gastric variceal bleeding and refractory ascites, and expanded polytetrafluoroethanyl stent graft is recommended by the recent criteria for tips treatments. So our studies limitations of this potentially limitations of this study was the non-randomized retrospective study and experience of the single injections and the lack of the large sample treated with the tips and gastrocoronary vein embolizations due to the management of the esophageal and gastric variceal bleeding by multidisciplinary departments. So study conclusions, the result is suggesting that the tips combining with the gastrocoronary vein embolizations is effective and safer in the treatment of cirrhotic portal hypertensions and induce the esophageal and gastric variceal bleeding. So on tips with the gastrocoronary vein embolization, it is may prefer as the first line treatment for the high risk or rebleeding and more than the 25 mHg portal venous pressures with repeated variceal bleeding, and this strategy can improve the survival rates.